Hey, it's Steve Marshall from Jenny and Friends here, Cozy 101.1, and I'm sitting with Dr. Pyle Kohli, 9 News medical expert, and she's with Cherry Creek Heart in Aurora. And this is something I've been thinking about, so I'm kind of glad that I get to sit here and chat with you about it. It's TRT replacement for men.
Yes, that's right. It's huge.
What are your thoughts on this? Because I've toyed with it. I'm over 50. And so you see various things. You should do it. You shouldn't do it. It helps with this, that, or the other thing. So what are your thoughts?
TRT stands for testosterone replacement therapy.
Right.
And the idea here is that, just like women, as they get older, they go through something called menopause, where their estrogen levels go down. Men can go through something called manopause, where their testosterone levels start to decline. In fact, after the age of 30, you have a decline in testosterone of about 1% every year.
Okay.
And for most men, most healthy men, they don't start to feel a lot of the symptoms or side effects from that low testosterone until about their 70s or so.
Okay.
So it takes several decades for it to be clinically significant decline. But what we're seeing, Steve, is sort of two types of trends out there. One is, the men who are over the age of 30, kind of more middle age, 40 to 60, thinking about testosterone. But I'm even seeing in my clinic young men under the age of 30 thinking that their fatigue, their mood swings, their lack of motivation, what have you, is due to low testosterone. So that's where I really want to be clear that it's very unlikely for a less than 30-year-old man to have true what's called hypogonadism, where the testes are failing, they're just not making testosterone.
Okay.
Most of the time, this is a marketing, social media, and people really craving this sort of wellness culture.
Everybody's an expert on social media.
That's right. And everybody wants to live better and be healthier, and testosterone more must be better because it builds muscle mass and it builds longevity. But that's where the thinking is backwards, because what we're seeing in the medical literature is that a lot of this TRT is actually causing more harm than benefit.
Like what?
So as a young man, if you start to take exogenous testosterone, and this used to be a big controversy earlier, remember during the Olympics when athletes were doping with testosterone and such. But really what it does is your brain usually sends a signal to your testicles to make testosterone.
Okay.
When you take exogenous testosterone from outside, the brain sees that exogenous testosterone and says, oh, I better shut off the testes from making any because we have enough around. And so the testes actually start to shrink or atrophy. And for some men, that can be permanent. So it can even affect their fertility because it doesn't come back. And then too much excess testosterone can lead to breast growth in men. It can lead to blood clots. It can lead to metabolic problems, certainly risk of prostate cancer. And it can even lead to conditions like male pattern baldness that get accelerated if you have a genetic predisposition. So now you've really done the opposite of what you're trying to do, which is to look young and virile and be fertile. And instead, you're shutting off your fertility, you're accelerating the male pattern baldness, you're getting, male breasts, and you're having obviously many of the metabolic side effects as well as a thicker blood and higher risk for blood clots and sleep apnea.
Is there ever a point where, I guess if you go to a doctor, but there's a point where it might be a good thing?
So what I would say is if you think you have a testosterone deficiency, it's really important to prove that medically. And the way that you do that is you go to your doctor and you get your testosterone level checked. But you can't just check it once because testosterone goes up and down during the day.
Okay.
If you have a bad cold or an infection or you're stressed or you had a bad night of sleep, your testosterone level can be affected the next day. So you really want to have multiple measurements of testosterone that show that you have a clinically significant testosterone deficiency, adjusted for your age, of course. Because remember, I told you it's supposed to go down as you get older. Doesn't mean you're just supposed to replace it. And then if you do decide that you have a testosterone deficiency, especially as an older man, then you want to talk to your doctor about using testosterone replacement therapy in a very graded and controlled fashion. So I see a lot of men, and in fact even women, now using testosterone replacement therapy in the form of pellets. And I'm dead set against pellets. Because what happens with pellets is they go in, you can't take them out. You can't control how quickly the testosterone is being released. And some of the formulations on the pellets are not the ones that have really been studied. And so what we have studied is TRT, or testosterone replacement therapy, in older men. We're starting to see some of the adverse cardiovascular benefit risks emerge. So I tell my men that if you really want to try TRT, I want you to do it the lowest dose for the lowest duration, do it in a controlled fashion under the guidance of a doctor, not a longevity expert, not your trainer at the gym.
Not some guy on social media.
That's right. None of those. You just get it in the mail from Amazon or from some other pharmacy online. That's not how it works. You really want to make sure that you think of this as a medication intervention, not just as a supplement or something that you're trying out.
Oh, it's so confusing, especially when everybody, like we said, everybody's an expert on all this.
Yeah.
And I had actually thought about it. There's ads all over Instagram and
Yes.
things for this
Yes.
stuff.
But if you're thinking about it, like I said, an endocrinologist,
Yeah.
a primary care doctor, great resources to talk about your why, which is the biggest.
Right, right.
Why are we trying to do this? Because there are risks. And then proving that
Yes.
you really are deficient, and then doing it for a very short duration if you are going to do it. But in general, my take as a cardiologist is less is more. And the way we're supposed to age is with our testosterone going down, and replacing it back doesn't necessarily cause benefit, whether it comes to mood or
Okay.
whether it comes to muscle mass or whether it comes to many of those other things, and can cause potential risks.
So again, it's one of those things that you might want to check with a doctor before you just jump on it. Thank you so much for clearing some of that
Thank
up.
you, Steve. I hope you'll talk to your doctor if you're still
For
thinking
sure.
about it.